Kia ora, my name is Susan Reid and I work for Health Literacy NZ. Health Literacy does a lot of work with patients in whānau with long-term conditions. And what we find is they often get really upset and angry when they've seen a health professional and they find out that their long-term condition has got worse to the stage where their treatment options are really limited. Often the patients didn't know that their long-term conditions could get worse, and they didn't know they were being monitored to see if things were getting worse, usually through blood tests. So the purpose of this presentation is to give people with long-term conditions information about how some of those long-term conditions could progress and questions you could ask your health professional. So this slide looks at long-term conditions, and as you know, they're different from acute conditions which you have for a short time, such as a sore throat, and then you get better. So with long-term conditions, you live with them, generally they don't go away. And even if you're active, you eat healthy food, you take your medicines, your long-term condition can progress for lots of different reasons. But part of self-managing your long-term condition is knowing if your condition could progress and what you can do to delay or prevent that progression. Also, the big thing is that you don't have any surprises. So if your long-term condition is being monitored, you can see, oh, actually it's getting a bit worse, or it's staying the same, or it's improving. So you don't get surprised by this. So here's some questions you can ask your health professional about your long-term conditions. Will my long-term condition stay the same or get worse? What can I do to stop or delay my long-term condition getting worse? How will I know if my long-term condition is getting worse? And what can I expect if my long-term condition does get worse? All this is helping you anticipate the next steps. So let's look at type 2 diabetes. It's a common long-term condition, and let's look at how it can progress. So if you look at the first part of this diagram, that's the stage when you don't have diabetes. The blood test called HbA1c measures the amount of sugar in your blood over the last 3 months. And if you don't have diabetes, that is under what's called 40 millimoles per litre. So that means you don't have diabetes. And the best way not to get diabetes is to be active, eat healthy food, and be a healthy weight. But as we talked earlier, some families have a history of diabetes that might progress to the next stages because of that family history. So you can progress from not having diabetes to the next stage, which is called pre-diabetes. At pre-diabetes, your HbA1c is between 40 to 49. And even if you're staying active and eating healthy food, you can still progress. Now, one of the key things that happens if you get pre-diabetes and you're overweight is that your health professional may advise you to try and lose 5 to 10% of your body weight. So if you weigh 100 kgs, they might say it's a good idea to try and lose between 5 and 10 kgs if you can. And the next part of the diagram is when you actually progress to having diabetes. So your HbA1c goes over 50 millimoles. And usually at this stage, you're taking oral medicines to help what insulin your body is still producing to work as well as possible. And the last stage is when you have to inject insulin. Now, not everyone will progress to having to inject insulin, but it's a good idea to ask your health professional how likely this is for you so that you have an idea of it and can start thinking about it. So let's have a look at another long-term condition, chronic kidney disease or CKD. And remember, chronic is just another word for long-term. So chronic kidney disease is a long-term condition where your age can cause the condition to get worse because as we get older, our kidneys don't work as well. Chronic kidney disease can also progress because the person has other long-term conditions that may not be well controlled. For example, if someone has type 2 diabetes and high blood pressure and they're not well controlled, then that'll cause the chronic kidney disease to progress much faster than if those other conditions were well controlled. Chronic kidney disease is measured by something called your EGFR, which measures your kidney function. And EGFR stands for estimated glomerular filtration rate. a lot of people are not aware of their EGFR, even though it's measured as part of routine blood tests. And the reason it's really good to keep an eye on that is it helps you not be surprised when you move to stage 3 or you're getting actually to be close to stage 4. Because if you get to stage 4, then you'll be talking to health professionals about treatment for kidney failure, which is stage 5. And often a lot of people we work with who find out they're at stage 3 or stage 4, that's the first time someone's explained to them they've actually got chronic kidney disease, and actually if they did something about their diabetes control and kept their blood pressure under control, this would help the health of their kidneys. So it's really important to understand how your chronic kidney disease is being measured and what stage you're at and what that might mean in terms of the next stage. So let's talk about another long-term condition, and this one is gout. And gout is different from most other long-term conditions because, as we've talked about, most other long-term conditions rely on managing lifestyle factors such as healthy eating and being active and taking medicines. Now with gout, what's much, much more important is taking medicines. Lifestyle factors, they're useful, but they're not essential. But taking medicines is really essential. Most people get gout because it runs in their family. Their genes affect their kidneys and stop their kidneys from getting rid of uric acid, and therefore it builds up in their bodies. So gout can be treated with long-term medicine. They're called urate-lowering medicines, and you can get to the stage when you don't have gout as long as you keep taking this medicine. So let's have a look at the diagram. So initially you have what are called gout attacks, or doctors call them gout flares. And basically that's when you have really painful attacks in your joints because the uric acid has crystallized in your joints. And they're usually just treated with pain relief. Now if you have more than 2 gout attacks in a year, that's when you're usually asked to start on a urate lowering medicine, such as something called allopurinol. And then you go on to the next stage, which is you're taking allopurinol and you're working on bringing down your uric acid levels to what's called the target, and the target is 0.36. So you might have to start off on a low dose of allopurinol, and depending on how quickly you can get to the target, your dose of allopurinol might be increased 2 or 3 times. And the last stage is when you don't have gout anymore because you're taking your long-term medication and you've got yourself under the target of 0.36. And the critical thing there is you have to keep on taking that long-term medicine. So here's a summary of the things we've talked about. Remember, you're the expert in your long-term condition, and most long-term conditions get worse over time. Part of self-management is knowing if your long-term condition is going to get worse and what you can do to delay or prevent that. You shouldn't have any surprises. Your health professional is an expert in long-term conditions and how they progress, but not an expert in your long-term condition. That's you. And the best way to manage your long-term condition is to work in partnership with your health professional. If you want more information, visit healthnavigator.org.nz. Kia ora.